Well, good morning, everyone. Thank you all for coming out here today. It's my pleasure to act as MC, Little Master of Ceremonies, and we're going to start our program very shortly. I'd like to recognize, before I do, the fact that I'm also joined today with Representative Mahaffey and also Chairman Conklin, Children and Youth. Once again, good morning. We are all here to discuss, obviously, a problem that definitely demands our attention. And with the incredible crisis that we all face, not just here in Pennsylvania, but also in the entire country with opioids, the issue of grandparents raising grandchildren continues to grow larger each day. Here in Pennsylvania, over 82,000 grandparents are raising over 81,000 grandchildren. On a national basis, we're looking at 2.6 million children that are being raised by grandparents or relatives. I don't think those of us that have a normal life imagine what it's like to have the responsibility of raising your grandchildren. Most of us that are grandparents, I'm a grandpop, you really enjoy having the grandkids come over, and you teach them things, and you take them places, and you work with them, and you have fun, and then you can give them back. But then you want them to come back again another day. But for many of the grandparents that are faced with the responsibility of raising these grandchildren, it is a 24-hour, 7-day-a-week operation. Many of these grandparents face enormous obstacles. They have no legal rights to these children, and as a result, there are continuous barriers that they have to overcome in order for them to take care of these children. What Chairman Watson and I are attempting to do is break the ice, and help our grandparents by what we call a temporary guardianship and also a navigator program that the chair lady will be discussing with you shortly. I cannot tell you how excited I am to have Chairman Watson join this fight. Chair Lady Watson has been the person that has devoted hours and hours and days and years to helping children all over Pennsylvania. And I cannot tell you how excited I am to have her as a partner in this battle that we face. So at this time, I'd like to introduce Chair Lady Catherine Watson of the Children and Youth Committee. Chair Lady Watson.
Thank you.
You're welcome.
Good morning. I always get a little strange about Chair Lady Watson or Good Morning Chairman. My name is Kathy Watson, and I come from Bucks County, and I very much enjoy working with Representative Pashinsky, who I don't call that when I see him. I call him Eddie. All right, so we share the idea that we are family people. We are grandparents. It so happens, as an extra footnote, I guess, one of us is a Republican and one is a Democrat. You figure it out. But the point is, children don't come, as my usual line, children don't come into the world with an R or a D or an I for independent or whatever it might be, already stamped on their little baby behinds. They are just children who are born expecting that the adults in the world will look after them, will teach them, and will raise them. I thank you for being here. Eddie has already said, sorry, I'm going to slip into it way too many times, but who has already said that indeed that one statistic, and it bears repeating, would be that we know of 81,000 grandparents who are the sole caregivers for nearly 30,000 grandchildren. I say we know because the truth is, ladies and gentlemen, we know there are a lot more out there. We just haven't identified them. They get to be reluctant to come forward and ask for help, and that's really the reason we are here today. And also because, sadly, what we know, the number is growing. The number is increasing. And so I would suggest to you that we're not looking at something that is, what is the phrase that sociologists use, a little blip on the screen? This is not. Sadly, this is evidently a rather long, ongoing trend. And we can't let that trend continue, and we certainly can't see to it that the people who are helping all of us as taxpayers and family members and Pennsylvanians, we have to help these people because they really help us. I certainly would like to also recognize that we have Acting Secretary of Human Services, Teresa Miller, here from the Department of Human Services. Thank you. Where'd you go? There we go. Okay. Very good. Thank you for being here. And indeed also the Department of Aging, we have Secretary Teresa Osborne. I lost everybody. Thank you so much. We didn't take assigned seats. But in any event, we thank you. And I think what this says to you, ladies and gentlemen, this is a collaborative effort. And I use that, not bipartisan, not by anything. It's collaboration. Because the only way that the opioid crisis can be corrected, fixed, improved, whatever word you wish to use, made better, if such a thing can be, is with collaboration. We all get together as the adults in the room and say, we have to help other adults who need our help. And most importantly, we have to help the children who become the silent victims in all of this. You have heard Representative Pashinsky talk about how the challenge of being an older Pennsylvanian, that's me, and raising grandchildren is. Think back, if you are a parent, think back to the time when you had, the after-school activities, the homework, the costs that go with all of that. But now you're perhaps retired already. And maybe you even had a great salary, but it was never designed. And if you talk to those financial planners, they don't plan on you raising a second family. But that's what our grandparents are doing. And they are summoning all that physical energy that they can muster to run around for a toddler, get somebody to school on time, see to it that the senior high girl gets to go out for cheerleading or the junior high boy gets to try out for the soccer team. Oh, that does cost extra money, but they're there. The problem often comes that grandparents are also very proud people. They've done a lot for this state. They've kind of served their time in all the things that they've done. And what we find is a universal trait. They don't want a handout. But the truth is, they do need some extra assistance. 20 or 30 years after they've raised that first family, they're doing it again. And they want to know they're on the right track. As many of you know, those of you that are older, you realize that even the things we were told when we had newborns has changed. And, oh yes, sleep that baby on his stomach, I can remember. And I used to look at that and think, are you sure? They don't do that anymore. Oh, you sleep the baby on his back. Logical, but your doctor used to tell you, your pediatrician, that was wrong. So grandparents also have to play a little catch-up. Regardless of how good they were, time marches on and things change. Resources are out there, but grandparents are often reluctant to ask about them. They believe that if they do, oh, wow, I'll go into the child welfare system. Oh, what will happen to me? Maybe the grandchildren will be taken away. Maybe the state will come in and they'll send people to tell me how to raise these children. I think I know best. I'll just keep my mouth shut. I won't say anything, and therefore I won't get any help with foster care, kinship care, anything. We want to keep families together. That is the objective here. When it's in the best interest of the children, and most of the time it is, and grandparents always want to do right by raising their grandchildren. These folks are actually doing all of us a favor, particularly if we're taxpayers, because they perform the service of keeping children out of foster care, and we know that foster care is very expensive. So therefore, I'm announcing today, and we are announcing, 2 bills and a resolution to help address the sensitive and timely issue of grandparents raising grandchildren. And my proposal is House Bill 2133. The number's not as important as what it is. This would establish the Kinship Caregiver Navigator Program. It's an informational resource for those grandparents. And for grandparents that are computer literate or not, we've taken care of that. It'll be a website. It'll also be a toll-free hotline number. The website would offer information on support and services available, and a specially trained navigator at the other end of the hotline would be able to provide support and guidance to a kinship caregiver and serve as a mediator to establish a relationship between the caregivers and relevant federal, state, local agencies, staff, programs, all of that. And in the back, you have the reason why we're here today. You can hear, we also brought a child in so you would get the full effect. The other measures that are sponsored by my good friend, Representative Paszynski, include legislation that directly addresses emergency custody issues, a major problem for grandparents, and also a resolution. We want to have a detailed, good study on the trend of what we now call grand families. What do they do? How do they work? What can we do to help them work better and efficiently and raise that generation of children? But Representative Paszynski says it best. I thank you again for your attendance today. You are an important part of this process. We need to get the word out. We need to make a difference, and we need to get this done. Thank you very much for your time.
Thank you, Kathy. Thank you, Kathy. Great job. Now, Kathy has indicated that we have 3 different pieces of legislation. One is a resolution, House Resolution 390, and the purpose of that is to have our state joint government committee put together their committee and then research Pennsylvania. As Kathy mentioned to you, there are many grandparents that are very hesitant to come forward and demonstrate their concerns. So that's the purpose of that one. Let's see exactly what we have in Pennsylvania, how many people are in this situation, and how do we address it. As Catherine also mentioned, my bill 1539, it's temporary guardianship. It's an emergency temporary guardianship. We have discovered in our forums, in our roundtables, in our hearings, both Catherine and I, we've heard the grandparents tell us their stories. And one of the major hurdles that they've had to try to overcome is the legal one. And that is they are not the parent. The laws right now provide protection for the parent and the child. The guardian, the grandparent, or another relative, they don't have the same rights. So it becomes a real chore, a real problem for them to be able to take them for medical care or enrollment, in a school because they do not have the authority. So that's the primary purpose of 1539, to give them that legal guardianship, temporary, not taking away the guardianship of the parent, but to allow the grandparent to be able to take care of that child without undue financial burden, undue time burden, and undue obstacles in their time together. I am truly excited that today we are joined with 2 of the governor's secretaries, and very excited to say that Governor Wolf has, through communication with me and many of my colleagues, have indicated his concern, his interest. He was also moved, like both Catherine and I are moved, by the stories of grandparents all over Pennsylvania. They conducted a forum in Pittsburgh, and that's when he heard firsthand the kind of stories, the kind of challenges these grandparents face. So I'm extremely happy to have and introduce to you Secretary Miller, our Acting Secretary of Human Services, who will also share some issues with you as well. Madam Secretary.
Thank you, Representative Paszynski and Chairwoman Watson, and everyone who's joined us to be here today. This is an issue the governor cares a lot about, and so do all of us who get to work for him. And we really appreciate all the work that all of you have done to bring everyone together to be here today. Whether a family member or a neighbor, I think we all know somebody who's been impacted by the opioid crisis. We know that parents are losing children, and children are losing parents every day. At the Department of Human Services, we've established 45 centers of excellence to provide high-quality services to individuals who are battling addiction. These centers provide treatment that is team-based and focused on the whole person, with the goal of integrating behavioral health with primary care. In the first year of operation, our centers of excellence have interacted with almost 15,000 individuals, with 71% of them engaging in treatment. That's a huge improvement in helping individuals access treatment. Prior to the Centers of Excellence, as few as 48% of Medicaid patients diagnosed with opioid use disorder were receiving treatment. While the Centers of Excellence continue to support individuals struggling with addiction, it's important that we don't forget about others being impacted, the families. It's time to make changes to ensure that families also have access to supports and services they need during this difficult time, which is why we're all here today. At the Department of Human Services, we aim to improve the quality of life for individuals and families in Pennsylvania. And it's our job to make sure that every individual and family has access to the high-quality services that they need. I know that navigating our system is not always the easiest process, which is why the support of navigators will provide an immeasurable amount of comfort to the affected families. Having a family member struggling with addiction is tough on any family in a variety of ways. The bills introduced by Representative Watson and Paszynski are certainly a step in the right direction, with the appropriate funding to make the burden a little lighter for all of those involved. With your help, we will continue to fight against this epidemic and provide high-quality services to those who need them. Thank you, and I now have the privilege of introducing my colleague and friend, Department of Aging Secretary Teresa Osborne.
Good morning, and I too want to echo the words of Secretary Miller, and thank you so much, Representative Watson, Representative Paszynski, for your leadership on this incredibly important topic of grandparents raising grandchildren, and for truly gathering all of us here together this morning with so many of our trusted partners who really do all share the same vision. That vision is to ensure that we can, across all levels of government and in every community throughout the 67 counties of the Commonwealth of Pennsylvania, to do everything that we can to support the children who are being raised in grand families, and to support the grandparents who are increasingly being called on to become the primary caregivers of their grandchildren. And as was mentioned, we know that there are many and varied reasons as to why this family dynamic is occurring. And at this time in our country's history and in our Commonwealth's history, we know that it is the opioid epidemic that is devastating families and communities across our country, including right here in the Commonwealth of Pennsylvania. And we also know that this caretaker role can be beneficial, can be incredibly beneficial for the grandparents and for the grandchildren, but it also presents challenges. On behalf of the Wolf administration, we at the Pennsylvania Department of Aging, we have a rather unique position in our role and in our efforts. Under the Older Americans Act, we are called to serve as visible and effective advocates for older Americans. And here in the Commonwealth of Pennsylvania, it's 3 million of our brothers and sisters who are age 60 and over. And by the year 2020, that year of perfect vision, 1 in 4 Pennsylvanians will be age 60 and over. And as you already heard statistics mentioned by the leaders of this effort in our General Assembly, we know that many of those individuals over and under the age of 60 are grandparents raising their grandchildren due to the opioid crisis. Therefore, we at the Department of Aging, working with our sister agencies, such as Secretary Miller at the Department of Aging, Secretary Levine at the Department of Health, Secretary Jen Smith at the Department of Drug and Alcohol Programs, our opportunity to leverage our resources, to coordinate, to communicate, to collaborate in order to ensure that we provide the stretch that we can in order to support grandparents is incredibly important. We know that we must pause at every opportunity we get to listen to the voices of those individuals, of those grandparents who are facing the joys and the sorrows, the successes and the challenges of parenting literally for the second time around. And as we strive to better coordinate, communicate, and collaborate, it's incredibly important so that our grandparents are supported and our children thrive. We look forward to continuing to work with you on these efforts, stakeholders and advocates and elected officials alike, so that we can indeed ensure that our grandparents are supported and protected and that our children indeed survive and thrive and become the next generation of Pennsylvanians to ensure that this crisis is abated and that we use every effort that we can in order to ensure that our grandparents are indeed supported through this effort. So thank you very much.
Thank you very much, Madam Secretary. Appreciate it very much. By the way, there will be time for some questions afterwards if you'd like. At this time, I think it's most fitting and proper that we hear from some of the grandparents that can tell you firsthand what their stories are like. So at this time, I'd like to bring Lottie Powell.
Good morning, ladies and gentlemen. Our story started in another state. Our granddaughter was in New York State, and for us, we did not have to deal with the opioid crisis. Rather, we had to deal with caregiver neglect. Our granddaughter was very close to death at the time that we found out what was happening with her. She was severely malnutritioned, and as a result, we have a child, as many opioid families do, where these children have extra needs. At the time that we received her, it was a year after we had seen her last. We got a child that was basically skin over bones. And it was extremely hard and extremely devastating and very difficult to try and get any foothold at all to even be heard. In our particular case, they recognized the stepfather as the dad because he had made his way onto the birth certificate, since the birth certificate was left void at the time the child was born. You can hear her in the background. Last night was so cute. We were at the restaurant and we'd given her sugar right out of a packet, and she finally sat there and said, "Sugar, sugar, sugar." And it was the sweetest thing because it was the first time that we'd seen her independently take on words. And at 2.5 years old, that is a developmental delay. When we did get her back into Pennsylvania, we fell through every crack. We were unable to have support through children and youth, through no fault of anyone in particular. It was the way that the circumstances came out that we were handed the child directly by a judge in another state. We began trying to find any and all resources here in the state, and there were none. There was nothing to find. It was a very long process to find a resource. And that's what spurred me into getting in touch with our state legislature to find out what's going on. These are the stories. This is what's real. Last June, I sat and I read our story to the Children and Youth House Committee, and Catherine Watson was very, very touched by it, as Eddie Pashinsky was. And hence they've asked me to participate, and that's how I'm here. So the long and short of it is they're trying to find any resource for these children is virtually impossible. And that is why this caregiver program, this caregiver navigator program that's being introduced is of such value, because there has been an awful lot of work going in on the part of the legislators to try and find what resources are there and try to put them together, because there is no one place to go to open a book and say, oh, I can go to agency A, I can go to agency B, agency A has this, agency B has this. Now, you sit as a grandparent, you get your child to sleep hopefully before 10 in the evening, and then you're up till 1, 2, 3 in the morning trying to find the resources so that you can go through the next day, trying to find, is there a diaper bank to help me with these children? Is there a place that I can find to get some formula for these children? Okay, I have WIC. Now, how does that play out for these children? Pennies a day for fruits and vegetables. And then on top of it, when you do go, when you do find someone to help you, everybody says go to social services, you find out that you're penalized as a grandparent, because not only is there the criteria for applying, but then once you've applied, then they look at what are your expenses. Well, now, perhaps you've already paid your car off. Perhaps you've already paid your home off. Now you don't meet a net income level. You only have a gross income level that you've met, which is nice to knock on the door, but nobody can help you. And this is what we face on a daily basis with a little one on our hands, whatever age they are, whether it's a 2-year-old, a 12-year-old, a 17-year-old. This is what we face, and we don't have the resources. And that's why I'm so grateful to see what's being done on the Navigator resource, on the legislative side, to try and help us on the side to try and give us a legal ground to work with our children, because we don't want to lose the families that we have left. Our children are the ones that have had these kids, and we face losing our own children in the process of trying to get legal assistance, because now they view us as the enemy, and we're not. We're just trying to help our own families. Thank you.
Thank you very much, Mrs. Powell. I want you to also think about something. So the grandparent has to deal with the reality that their daughter or their son, the father or the mother of their grandchildren, have an incredible obstacle to overcome if they are addicts, or if they have an alcohol problem. So not only do they have to face that, but they have to now then take care of that child. And I want to make sure that we emphasize the fact that those children are really critical, because if we fail those children now are no longer productive, no have a future. The consequences end up to be incarceration at $35,000 to $40,000. That's why it's imperative that Chairman Watson and myself are looking for ways that we can find some dollars so that we can protect these kids and make sure they have a chance to become a productive individual, successful. Another story that I want you to hear today is of Joanne Clow. I not only heard the story, but I had the wonderful opportunity of meeting her daughter and her granddaughter. It was in Scranton, and it was uplifting. I'm going to have Mrs. Cloud tell you the rest of the story.
Hi, my name is Joanne Harrison Clow. I'm a 61-year-old mother of two daughters, Emily Marie and Diane Elizabeth. I'm also a family law solo practitioner. I'm a true single parent in the sense that when my daughters were 4 and 5 years old, after a very nasty custody battle, a little protection from abuse incident, my ex-husband decided to never see my daughters again, ever. He hasn't seen them in 17 years. So I was a 365-day a week, a year, mom running her own little law office, trying to raise two daughters by herself. My daughters had a very hectic and active childhood, including competitive cheerleading, flying all over the East Coast of the United States to watch them tumble and do backflips. They did t-ball, softball. We did summer vacations in Eaglesmere, Pennsylvania every year. Both were very talented, funny, independent, outspoken children who were exceptionally good at conversing, and also you knew where they stood on any issue at any time. They were both honor students. And yet I stand here before you today because one of my daughters, Diane, age 21, in the front row here, is a senior at American University in Washington, D.C. She graduates Mother's Day morning, and the university has given me official notice that that's going to take place, or she might not be sitting here today. And she's currently an intern with the Addiction Policy Forum in D.C. She was an intern last semester with Senator Casey. She talked me into letting her take a semester off where she was a paid employee on Hillary Clinton's campaign at age 20 years old. And she's done several other internships. And my daughter Emily, that Representative Pashinsky talked about, is forever 22. And she's buried on a mountaintop in Eaglesmere, Pennsylvania, next to my father. Emily had, when she was 17, at a party after graduating, somebody got her to try to snort heroin, a boyfriend, and it turned into a 5-year battle that I don't wish on anybody's family. Emily had in the middle of all of this, when she's 4.5 years into her addiction, she found out she was 5.5 months pregnant. And she did everything she could to try to get off of heroin. She had to go on a method maintenance program to preserve her baby in utero because the baby would die if you stopped using. And we had a beautiful granddaughter born on February 27, 2016, not addicted, which was a miracle. And 9 months later, on the way to work, for reasons we'll never know, Emily decided to buy heroin, and she was sold a packet, which turned out to be pure fentanyl. It killed her instantly. She was missing for 18 hours before somebody saw her dead in her car in the parking lot at Starbucks by the East Mall. And to receive that news as a parent is devastating, but to have a 9-month-old granddaughter down the hall who no longer had a mother, and to be 60 years old, and have the father be the addict that introduced my daughter to the substance and was only allowed to have supervised contact with her himself because of his continuing addiction struggles. That rock that I had finally rolled up the hill and almost had that 21 and 22-year-old out of the house rolled right back down on top of me. And I'm now raising that 9-month-old baby who turned 2 February 27th and is doing very, very well. But when you are a grandparent suddenly faced with the worst tragedy you can imagine, in addition to picking out a casket and planning a funeral for your daughter, you have to figure out how you're going to suddenly raise a 9-month-old. We were lucky we didn't have daycare for Carter when she was little because I could watch her when Emily was at work. Last year, I paid $14,790 for daycare. That was not in my budget. It has absolutely devastated me financially. After Emily passed away, I'm a family law attorney. I did not even know what to do to try to get help. I knew how to file for custody because I do family law. And when my granddaughter's father casually mentioned he was going to take the money the people gave at Emily's funeral for Carter and maybe move to Louisiana where it'd be cheaper to raise her, I went and intervened in their custody action and got emergency, sole, physical, and legal custody of my granddaughter. I was very proud of myself. What I didn't know was by doing it that way, I eliminated the opportunity through the kinship program to have had help with daycare costs. And that type of process, you just continue to go forward. WIC called Emily to see why she hadn't shown up for her appointment, and I had to explain that she had passed away, and they told me I could still come in. And I was embarrassed about that. Like, I'm gonna go get free stuff, and they said, do you have daycare? I go, yeah, well, they go, well, you might as well come get the milk and the cheese and the beans and your $8 of fresh fruits and vegetables and my dozen eggs that I can get each month, and my cheese, not sliced, and only certain kinds, not Vermont cheddar, just cheddar, and to help at least with a little bit each month. So I learned to do that. I learned I didn't qualify for the daycare subsidy program because they count my income. They counted my daughter, Diane's, student work study income as part of her ability to go to college as part of the income to exclude us from getting help with daycare costs for Carter. The Social Security, we learned about that. Thank God my daughter, she was on her way to work when she passed away. She was a very hard worker, so Carter does get Social Security benefits. But as a grandparent, you don't know any of this. My daughter's addict boyfriend knew all of it. Anything related to money he knew and had already applied for before I got to any of the offices. So I had to constantly go and undo everything he did. But the worst part of it, and this is why I'm so in favor of this Navigator program and the joint state committee to research this more. As a grandparent, you are going through the worst time of your life if you had somebody die from this crisis, opioid substance use disorder. And at the same time, you have to somehow be there for this tiny child to help get them whatever you can. We don't want handouts, but we need help. I said at a committee meeting the other day, I don't think there's that many people in the United States that are paying senior tuition at a college and paying daycare for a 2-year-old. I said, unless they're rich dudes with trophy wives, possibly. But seriously, that's not an income thing in financial planning that you have. And nobody wants a handout, but we do need help. These kids need help. I don't get to be just a grandma anymore. I don't get to take her and give her back at the end of the day, or as Emily used to say, you're not her mom, Mom. Well, you know what I am now? I'm Mama Go-Go. I'm Mommy Go-Go, because some days I'm her mom and some days I'm her grandmom, but I'm always both of them. And we are very thankful to have Governor Wolf and the representatives that are here today and the secretaries from the different departments trying to help us, because we need help. These kids need help. Families are being absolutely devastated by this. There's health insurance issues, there's guardianship issues there. How do you sign them up for school? Anytime I go anywhere, I need to have my custody order with me so they know. And I speak out about this. My daughter, Emily, was not a public speaker, but she did speak out with Representative Paszynski. She wanted to talk out about the struggles and how hard it was. My daughter, Diane, speaks out about it, and we're all very thankful you're here today to hear our stories, because we do need help. Grandparents need to know what to do when this horrible situation happens to them. Thank you.
Just by watching your faces as you heard this story, and as Catherine Watson and I have heard many stories before, you cannot possibly not be moved. So we're going to need your help too now. But we are very excited that we are getting some help from some other folks as well. Today I'm proud to present to you Joanne Bensko, who is the CEO from the Pennsylvania Partnership for Children. And I totally enjoyed my conversation with Joan, and we are so grateful to have her on board. So at this time, let's hear from Joan and tell us all the things she's going to help us with. Joan, thank you.
Thank you. Thank you. Thank you, everyone. I'm Joan Benso. I'm the president of Pennsylvania Partnerships for Children. We're the statewide independent child advocacy organization. I want to thank Chairwoman Watson and Representative Paszynski for their leadership on this, and to Secretary Miller and Secretary Osborne. But most importantly, I want to thank these two remarkable women for the commitment they're making to the kids and their family. I join them in that great honor of being a 60-something-year-old grandmother, and I have the easy job. And it is just good luck and the grace of God that I don't sit in your seats. So as someone who, with Representative Watson's gonna hang it up this year and retire so we can spend more time in our grandchildren, I can't think of anything more important than to help these families. Pennsylvania Partnerships for Children has been working on child welfare policy for many years, and our goal has always been consistent. Our principles have always been to prevent a child and support a family so that children don't have to enter the child welfare system. The number one reason we remove kids from their homes, the number one reason we've removed kids from their homes for well more than a decade is substance abuse. But when we remove a child, our principle has always been that it's best, and the research backs us up, if you place them with kin, a grandparent, a close family friend, an aunt or uncle. It's not rocket science, people. The trauma that children experience when they are living in a home where they have to be removed is immeasurable. It is something they will carry with them for the rest of their life. And that trauma is in some ways mitigated by being with someone they know, someone who can make them instantly feel safe and secure. We know that when kids leave biological families, from research, the best outcomes happen when they're placed with kids. Kinship placement makes it much more likely that kids will be with their siblings, that they will continue to have continuity and connections to their community and their schools, that they'll have decreased behavioral health challenges or mental health needs. When I think about it, parenthood is the hardest job I ever had. And it's the greatest honor I ever had as a job. But think about it. Think about being my age, 60 years old, getting ready to retire, having raised two remarkable kids and now having a blessed grandson. Think about then saying, I have to go back to when I was 30 or 35 and have the responsibilities to raise a young child. Think about if you were never a parent and you never nana and you never had to put a child to bed or figure out childcare or help with homework. Imagine that. That's the reality for so many Pennsylvanians right now, as both Representative Watson and Representative Paszynski shared. According to the American Community Survey, the national census, there are 82,000 grandparents in Pennsylvania who are raising 89,000 grandchildren. Well, some of these kids are the 6,400 children that are in formal kinship foster care. The vast majority of them are not. And on top of that, that just counts the grandparents. That doesn't count the close personal friend and the sister or the brother who are also stepping up. Pennsylvania should be very proud of the work we've done in our child welfare system and our child protective system. Secretary Miller is deeply committed to these kids, and her Deputy Secretary, Kathy Utz, has had a long and esteemed career in ensuring that we are encouraging foster care placement with family, and we are doing the best we can to strengthen families. But as I just said, 6,400 children in kinship foster care. 89,000 children living with grandparents, an undercount, we know. So if I'm a parent, a kinship parent, a foster parent in a child welfare system, it's not an easy job. No one should suggest it is. And it isn't that those children have had less trauma or need less, but there are resources and supports to me. There are financial resources, I have legal rights, that these folks don't have. So we do a really good job for that group of families. They can call their caseworker in the County Children and Youth Agency any day. That caseworker will help them navigate the health and human services systems, the education systems. And sure, we could do more. But for this group of parents you heard from today, we don't do anything. So that's why we're very excited to support this legislation today. A kinship caregiver navigator program, as Representative Watson proposes in House Bill 2133, will only be this first step. It will be a place for grandparents and other kin to easily access by phone 24/7. That grandparent's up at 1 o'clock in the morning looking for those resources. On the website, with resources in their community and their county. And that navigator will help them navigate what's available. But rest assured, we'll have a lot more work to do following to help those families get what they really need to raise their kids. Many other states have already taken this step. Connecticut, Florida, New Jersey, New York, Nevada, Washington, to just name a few, are states that already have formal kinship caregiver navigator programs for families raising children not known to the child welfare system. And the research shows us again that this helps prevent later foster care placement. Actually, a 5-year evaluation from Florida's program tells us that 99% of the children that were placed in an informal caregiving situation with a relative or kin, a grandparent or someone else close to them, a year later weren't in foster care. That's a pretty remarkable thing. The average foster care placement in Pennsylvania costs us $25,000 a year, and 60% of that money comes from the state budget. Do the math, people. It's a lot of money. So we're here today with our colleagues and with these families to say, we're going to help you ensure that your voice is heard in this building, and that with leaders like Representative Paszynski and Representative Watson, we're going to hopefully quickly this year, this budget season, take a first step to begin to stand up and thank you for what you're doing for our children and support you so you can have a little bit of help. Thank you so much.
Thank you very much, Joan. Both Catherine and I can't thank you enough for your participation and support. Again, this is all hands on deck. That's why I'm saying we're going to need everybody. And Joan pointed out, we need to get this done now. We can't let another session go by, another 2-year term, before we actually address this. So we want to put this on a fast track. So by the time we finish our budget in June, or whenever it's going to be, we want to make sure that this is part of that acceptance package. One other individual I want to present to you also that we're gratified for their help is Angela Little, President and CEO of the Pennsylvania Family Support Alliance. Angela?
Good morning. I had the privilege of meeting Joanne Clow this past summer, as well as I see Wendy here in the audience and a few other grandparents. We partnered with Highmark's Caring Place and had a forum for folks who were struggling raising their grandchildren as a result of the opioid epidemic. When I met Joanne this summer, she was barely able to really speak about the situation that she was facing. So I don't want to say what a difference months can make, but what I want to say is by the end of that forum, I sat there. You know, I think I'm relatively young as a grandparent. In fact, my granddaughter doesn't call me grandma because I believed I was too young to be called that. So I have this really cool, trendy name. It's May May, you know, and she does the little May May rocks kind of thing. And we do all these fun adventures, and we have our special time and kind of our secret code language that only we have. And hands down, she is my favorite human being on this earth. And I sat listening to these parents. I sat just watching alligator tears roll down Wendy's face this summer. And I thought, my God, I just don't even believe I have the strength that I could do what they're doing. And then I got an opportunity to again work with both Highmark and with the Wolf administration in December, where we brought together again grandparents, some from, you know, the western part of the state who had very different situations and experiences. As the governor sat on, I think, December 21st, a couple days before Christmas, when most of our state's preparing for a holiday and there's bright lights and everyone's happy. And he was joined by all four cabinet secretaries. Secretary Osborne, Secretary Miller was there, joined by their colleagues from Health and DDAP, and listened to the very heart-wrenching stories. And what we committed to as an organization was to make sure that folks like Representative Watson, like Representative Pashinsky, like members on the House Children and Youth Committee who are looking and have been meeting and talking about this issue, that folks hear their experiences. Pennsylvania Family Support Alliance provides services statewide that quite simply protect children from maltreatment, from child abuse and neglect. We work with agencies statewide who provide every single week family support and education programs, somewhere around 150, 160 programs each and every year, serving thousands of families in the state. And then we do other pieces of education that help professionals and volunteers understand what our law says about child abuse, how to recognize it, how to report it, and training programs that engage community members to do their part. So here's what we know, though. The cornerstone of our organization is that the very best and first step to preventing child abuse is good, strong, positive parenting. And in reality, it's no new news for us in our programs statewide to see grandparents. We've seen them for decades, and I'm soon celebrating my 25th year and watching colleagues all around me getting ready for retirement and realizing, well, yeah, but you were one of the younger ones. It's okay, keep going. So the reality is we've seen this, but we've never seen it with the magnitude. We've never seen it with some of the emotionalism that is just raw but very truthful. Grandparents are a proud group. You know, you kind of paid your dues. You made your coffee. You raised the kids. And for so many people, and sadly you look at Joanne, you look at Wendy and many others, and Lottie, and you say, you know, what happened to those golden years, to what you were envisioning your retirement would look like? You know, your stories changed, your life changed in the blink of an eye in ways that most of us don't even want to admit can happen. And so, you know, you don't get to spoil your grandchildren like I do. You don't get to just have those fun adventures because you're the disciplinarian, you're trying to figure it all out. When I saw Joanne in the fall, she was limping. She forgot about the baby gate in the dark and went flying. And so much for that knee replacement she had a few years ago. And it seemed like harder and harder to get a good break and do the work that you need to do, that you've willingly stepped forward and said, I can do this because I love this child. So, you know, most of us in this room, and I'm realizing how young some of you really look. I'm not sure you even have children, but thank God there's a few with graying hair in here too, who can realize and remember how fatigued and stressed we were when we were doing those tasks, as my colleague Joan said, in our 20s and 30s. Just imagine these folks shouldering the responsibility now in their 60s and 70s and beyond. And so we look at, from our perspective at Pennsylvania Family Support Alliance, of course we support the proposed legislation of Representative Pashinsky and Representative Watson. But again, I echo Joan in saying this is just a first step. Information dissemination is one thing, but you have to have information to disseminate that is meaningful for the people who need the services. And one thing we have heard time and time again is that the grandparents are very, very focused on accessing services for their grandchildren. We understand that, we applaud that. And we also know that these grandparents need services. Parenting today is very different than when you parented 15, 20 years ago, your children. You're going to have to learn about the sexting. You're going to have to learn about screen time and all kinds of crazy things that didn't exist. And the challenges are different. And how do you protect your grandchild now from some of the forces that you didn't even know maybe existed that took your own child's life? It's a different day. And so these grandparents need access to services, but they need services that they really need, and they don't need them 5 years from now. They need them today. They need access to subsidized daycare. There's got to be a way to figure this out. It is unacceptable that a grandparent in their 60s who now must maintain employment cannot afford daycare to keep their employment. We've got to do something about that. And so when we heard the stories of Wendy and of Joanne and others, we said at the end of the forum at the Highmark Center, I said, I can't guarantee you anything, but if you'll work with us, we'll make sure you get in front of the right people who need to hear your stories. And I can't tell you how happy I am that some of those folks were Representative Watson and Representative Paszynski, because they listen. And we trust them to do something. But they need everyone else, too, to link in partnership and make sure that this is not a forgotten issue, that we don't just stop with something on a website or an 800 number to call, but that we have real substance of the services they need. Guardianship, of course, is a great first step. We need lots of training and education for those members in law enforcement who have to do what we hope is a warm handover sometimes at 11 o'clock at night, but maybe sometimes isn't very warm because people aren't trained and they don't really know what to do. And my God, can you imagine a more emotionally charged situation? So we're committed to being the partner throughout the Commonwealth that helps get grandparents in front of key folks who can help bring about change that they need to make their lives a little better. I was very encouraged. Former Secretary of then Public Welfare, Bev McAreth, and I had a long discussion with Secretary Osborne the other week. And we're looking again at still bringing together small groups in pockets throughout Pennsylvania of grandparents, because we need to hear as many of the stories as we can so we really can capture all of their needs. We can't just do this part way because this situation is not going to change anytime soon. The other thing I think that we really want to look at doing is playing a role not just in getting the voices of the grandparents out there, but I think groups like Pennsylvania Family Support Alliance, and there are many others, we need to look at how can we support the grandparents in this role. And one of the ways we've heard very often from Lottie at the House Children and Youth Committee meetings is bringing grandparents together who have walked a very similar path. For those of us who get paid to do the work we do and who haven't had these experiences, we really can't sit with you in your situation and say we understand, because we don't. But I think the shared resources, the shared information, the shared support is something that we very much want to look at. How do we nurture the grandparents while they're trying to do this? One of the things we've heard, and Joan, I think very clearly told you the numbers. Do the math of, I think it's on average $25,000 a year in this state to have a child in foster care. Am I correct off the top of my head? So do that math times 89,000. And one of the things I have repeatedly heard, and I've kind of lost patience with it, and I hope most people have, is that our child welfare system cannot absorb these children and care for them. Well, let's talk reality about this. If these grandparents go down on their knees and they don't get up, the child welfare system will be taking care of them. It's plain and simple. They're not going to have a choice. So again, it's not high-end math. Think about what makes more sense. work with these folks and try to figure out how to get them access to services that keeps a family intact, albeit a different configuration of a family, that can help nurture the grandparents in what has to be the worst, most unimaginable time in life a person can experience. Because the truth is, we don't really have a choice. Thank you. Please don't let this issue become just an issue that passes and we go on to something else. This is very, very important. Wendy, Joanne, Lottie, thank you for being willing to meet with these folks who sometimes we kind of think they're intimidating, you know, members of the General Assembly, secretaries. They're folks, they're humans, they have feelings, and they need to hear your voices. So thank you.
Thank you so very much, Angela. I appreciate it. At this time, I would ask Kathy, you want to join me, please, at the podium? And both of us would like to thank our staff, Greg and Chris,
Yes.
for helping us. Absolutely impossible to do this job without the staff folks, and I mean that. I know we both mean that. They're tremendous. The other thing that I want to share with you is we've put together a GRG caucus, Grandparents Raising Grandchildren Caucus. We haven't had our first meeting yet, but there are 25 members. Representative Mahaffey is one of the key members here. And what we're going to try to do with that caucus is get their opinions, get their stories from wherever they represent to begin to help drawing a larger group of folks to help us. It's going to take all hands on deck. And collaboration. And you're right, Catherine. We are Americans before we're anything else, aren't we? This is not a political issue. This is a human issue. And we have to obviously work hard. But we've got to get it done by this budget.
I'm getting old really fast. Yes, please.
Now, we'll take questions.
Sure.
We were that thorough?
I was a teacher and I would say, oh, I must have done a good job. Or the other part of being a teacher was I remembered you just overloaded them so much, their heads are blown and they can't. We thank you very much for being here. You are, and it's not pandering, ladies and gentlemen of the media, you are an important part of this because you get the word out and also encourage somebody who's listening, whether at home or reading a newspaper or whatever it is, and they have those issues, to maybe contact their local legislator and say, if you think it isn't happening here, it is. This is what's going on. And for me, this is what I see I need. I think, too, when we were younger, we would all stand at the playground or whatever, and you formed your own little caucus. But when you're a grandparent, you're very separate. In some cases, you feel you don't want to talk about it. And so you just kind of live in silence and figure it out on your own. So you're getting the message out. It's not wrong to ask for some help. And they didn't do anything wrong. In fact, they're doing everything that is laudable. And we thank them. So you're important to get that message out. They don't always listen to you and I sometimes. Hard to believe, but they don't. So we appreciate all of you for being here today and taking part in this, and I'll call it a kickoff, really, of what will continue and an important issue for everybody in Pennsylvania. Thank you.
Thank you.